afternoon. My name is Dr. Laszlo Kiraly. I'm Chief Surgeon, Chief Pediatric Cardiac Surgeon at Sheikh Khalifa Medical City, and I'm going to talk to you about the business models we employ in our services. Let me start with some background. This is UAE with a population of reaching above 7 million, and we know that congenital heart disease comes in 160 to 180 deliveries. That's a huge patient population. Actually, it's around almost like 600 to 800 neonates a year with congenital heart disease born at the UAE. Now, 2/3 of that patient population would need surgery, and 2/3 of the surgical population would need surgery in the first 6 months of life. So this is a very high business model with a relatively concise and relatively clear and uniform patient population. But we need to care for patients from neonatal age, almost like adolescent age, to the so-called grown-up congenital heart population group. So it's very important that we build our services along the needs of the patients, and that means that we provide treatment from the neonatal age to the adolescent age and all complexities, as I said. How come business models can help in that process? First, when establishing a new program, apparently there are a lot of criteria that a program needs to fulfill. One of them is to meet the international standards on patient outcomes, and then certain procedures we need to follow, certain facilities we need to build. One of them is, importantly, the OR, the ICU, the whole professional environment, including the staff and knowledge. The second one, how we actually deal with the patients, how we admit them, on what time frame, what preoperative investigations we do, and then how we proceed with operations and the postoperative care. So the whole package comes in one. When we established our services in 2007 at Sheikh Khalifa Medical City in Abu Dhabi, the program started from the very start. We started from the first operation. The international team came and outlined the continuity of care plan, and then the patient pathways and the protocols. And also we set expectations for the outcome, for the length of stay, and for all the necessities for care in terms of manpower, knowledge, investigations, consumables, and other services. How can, again, business models help in that setting? Certainly, there are strategic models can position our pediatric cardiac service by identifying characteristics of present future patient populations. Also set expectation and objectives for quantitative and qualitative need for our services. For the quality assurance and improvement protocols, and also these are the very robust quality care plan for the whole service. They will monitor clinical and administrative processes to maintain the center of excellence. For the operational models, they can help to identify the best practices to improve patient access and outcomes. A continuum care plan was set by the multidisciplinary team. In our team, we involve 36 nationals, and almost like over 100 people working together that the cardiac surgery is done. There are key performance indicators set from the international databases and according to those international databases. And these key performance indicators monitor care. By having established the necessary OR and ICU facilities, the technical interfaces and their respective teams, a full range of pediatric cardiac services was offered for complex neonatal open heart surgery to grown-up to grown-up congenital heart diseases as a new modality. There are special programs we also introduced, that is mechanical circulatory support, ECMO, or extracorporeal membrane oxygenation, and also a hybrid program, and so on. With the continuous audit and the outcome review as quality assurance, we were allowed to do adjustments in both the organizational and the professional care to minimize complications and to maintain excellent results. I'm going to present our plan and program for care for congenital heart disease. I'm going to establish the quality criteria of a program, and I will lead through the audience from the start to the current state of our program, what difficulties we faced, what challenges we had to outgrow to reach to the point that we are now doing almost like 400 open heart surgeries a year for babies and patients with congenital heart disease. It's also very important that we set expectations for the community on the best outcomes that are available in the UAE, not only the other advanced countries in the world. And also, it's very important that we position ourselves in the region as dedicated provider for congenital heart disease for the community. We also need to set expectations for the future, because our patient population will grow, not only in terms that they will survive and they will come back for a continuous follow-up, but also with the growth of UAE's population, we expect more patients coming for treatment to our center, and not only from the center, but also for the region too. So, coming together and summarizing those points, I will try to present the audience a complete framework of a quality care plan in pediatric cardiac surgery. Thank you.